Hi, I'm Charlie Harp, and this is the Informonster Podcast. And today on the Informonster Podcast, I have the one and only Dr. Sarah Matt. Sarah, welcome to the podcast.
Thanks, Charlie. It's nice to be here.
Well, for people that may not know this or may not know you, why don't you start out with giving us just kind of a background on you and your journey in healthcare. That's kind of the thing we do on the Informonster Podcast.
I like it. So I'm Dr. Sarah Matt, and I started off as a doctor. So I'm a surgeon by training, my fellowship's in burns, but I actually moved in the tech sector a long time ago, right from the beginning. And Charlie, we met each other a long time ago. We won't even mention how long ago that was. And so, I actually cut my teeth in product management at NextGen Healthcare back in the day, taking care of clients that were critical access hospitals, no money, tons of regulations during the meaningful use days, and kind of worked through the ranks there, did a lot of great work in patient engagement. And then as chief of staff, the chief strategy officer, where I definitely did some M&A I totally shouldn't have. But it kind of set the stage for an entire career in product and strategy. So I've done several startups, everything from ESO, which is pre-hospital, firefighters, paramedics, EMTs with some good exits. And then my last startup was Savato, focused on remote robotic surgery. And I'd say a big chunk of my career was at Oracle, doing everything from building out the OCI business for healthcare and life sciences, so cloud all around the world, to being a big part of that Cerner acquisition, which was an absolutely amazing experience. So I've been here, there, and everywhere. I still practice medicine. I've been doing charity medicine for a long time, internal med. I go see patients here in upstate New York a couple times a month. And I do a lot of teaching too. So I teach med students here at SUNY Upstate.
So you keep yourself busy is what you're saying.
I thrive on a little bit of chaos.
So one of the things that I wanted to talk to you about is you've recently written a book.
Absolutely. So the Borderless Healthcare Revolution is my new book, and it's out right now. Check it out if you haven't already. I know you have an advanced copy there, Charlie, so excited to hear your thoughts on the book. But it's all about healthcare access and how technology can decrease barriers to care. So an important topic that I think everyone can come together on.
That's great. What inspired you to write the book?
Well, at the end of 24, the United States was a very polarized place. And I'd say that people were really separating each other in so many levels. And healthcare is an area where everyone's got big opinions. And I was trying to think about how could I make a big impact here and how could I make things better? And healthcare access is a topic where it doesn't matter where you come from, how much money you make, what your situation is. We all struggle with healthcare access in different ways. And so to me, this is a topic that we can all come back together on and work towards improving all around the world, but here in the United States in particular. And from any vantage point, whether you're in healthcare delivery, whether you're on the tech side like we are, or whether you're building in other spaces. So I think healthcare access is, again, one of those topics that's so rare in that everyone has a story where they've had access problems. Everyone can talk about that and come together on a topic where we can all make impact together.
That's a great point. I think that, especially when you think about the world in general, and I'm a salty dog, and I have enough experience with healthcare in other countries to know that each region has its own unique set of challenges when it comes to access, when it comes to, getting the right information to provide the best care for patients.
Absolutely.
When you think about care here in the U.S., what do you think is kind of the biggest issue we have around access?
Well, I know this podcast is not going to be long enough to talk about all the issues in healthcare in the United States today, Charlie. But what I'd say is that we have lots of different barriers. To me, I break it down into financial, trust and knowledge, digital, cultural, and geographic. It's really easy to see the geographic barriers. Oh, we have people in rural environments. Oh, we have people unable to see specialists. But I think that one of the things that I know that you talk a lot about, Charlie, is data. And we think about the data that's really the heart and soul of healthcare, the ability to move it from place to place, the ability to have it be utilized properly with AI and the newest technologies, and the ability for that to actually improve patient outcomes. I think we don't recognize every day that sometimes that data is being collected, maybe not consistently for different groups of people. Maybe that data is historically not there. So we ultimately can't build great algos to help patients from certain groups. So what I'd say is that there's so many barriers. But one barrier that I know you and I have a lot we could chat on is really around the data, movement, quality, and who it's coming from. Because again, we have huge gaps in the ability for us to make that future work for everyone when we don't have the right data to start with.
And one of the things when I talk to folks, they kind of say, well, why is the data important? The people that aren't deep in the trenches like we are. And what I try to remind them without scaring the crap out of them is saying, listen, you got to realize that in this country, at least, we don't have as many providers as we used to per person. We have an aging population. We have providers that are experiencing serious time famine. And we also have people that are on the front lines of providing care that don't have the same kind of training and experience as providers.
Agreed.
And the thing that can help us, if we were able to get our arms around it, is technology. Because technology can kind of bring that artificial experience to the front. If we have a good picture of what's going on with the patient, we can augment the providers that maybe don't have the same experience. And also for the providers that do have the experience, we can automate a lot of those things that they really don't have the time to do. And so I'm always saying this is why the data is important, is because we can't really make the most of our technology if we can't rely on the data. That trusting that data is a huge barrier to providing better care. Is that fair?
I would say that's definitely fair. When I was training, we were in the days of paper charts, homegrown systems, some crazy big systems, you name it. Every hospital you rotated at was different. You basically grabbed the other resident's password and username and looked at the screen for 5, 10 minutes, and that was your training. And so probably not the best way to do things, but things have evolved. But if you didn't write it down, it didn't happen. And I think that's the trick, is that when you think about data, whether it's structured, if unstructured, you name it, if it's not in there, did it happen? And so right now, there's so much question. As a patient myself, I go to appointments and I have to fill out the same gosh darn forms a gazillion times. And I'm a doctor. I'm in the system. I know how this works. I've done all this stuff. For anyone else, it must be absolutely impossible because it's next near impossible for me. And so to think about access and how we can make that better from a data perspective. Someone asked me this yesterday. They said, how can you define the best state of access in one word? And I said, simple. Because right now, everything is just way too complex.
Yeah.
If we had the ability to just, I don't know, take that one intake form and use it a gazillion times, I promise you my birthday has not changed, and it won't. And it'd be great if I didn't have to write it down again.
I was, as you get older, you get to experience healthcare more and more. And I was in a radiologist's office, and this gentleman who's probably 90 years old was standing at the counter, and he's like, she said, go fill out the form. And he was like, I was here yesterday.
Sad but true.
You got to fill out the form anyways. And I could feel him, like the incredulity that this poor guy, like, I was here yesterday. Nothing has changed since yesterday. But so when you think about access, I mean, obviously, access is kind of like interoperability, right? It's a
Yes.
multifaceted thing, and there's being able to actually go see a doctor. There's being able to get access to your information. One of the things, and I have some more questions for you, but one of the things I'm curious about is there's a lot of folks out there right now that are basically pointing at artificial intelligence. You won't need doctors anymore because we'll have an artificial intelligence that will answer all your questions. And I know people that use ChatGPT. They feed their symptoms in, and I worked on a tool called QMR 2.5 decades ago.
Don't date yourself. Don't do it.
Diagnostic decision support, deterministically, but it did it.
Yep.
So, where do you think we are currently with AI as a way that people can get access to healthcare, and what do you think has to happen for it to be something that's realistic?
I still see digital as a barrier. So we just talked about all these issues with gaps in data.
Yeah.
The best algorithm cannot diagnose me or take care of me if they don't have the full picture.
Yeah.
And so, unfortunately, and this is something we learn in med school, is that the average patient doesn't exist. So if we're going to do some vanilla algo over the top of it, it's not going to be helpful for anybody. So if you want a great picture of a patient and what's going to help them most, you need to have their entire story. This is hard for doctors today because we're digging through charts. We're looking at, scanned faxes. We're trying to dig up records from a CD-ROM that's shoved someplace else. We don't have a full picture today. There's lots of organizations working on that longitudinal record if you must, but I can guarantee there's huge gaps. If someone asked me to get my entire record today, I don't even know where I'd begin. I've lived in several states. I've seen lots of different doctors. It wouldn't happen. And so AI has great potential. No question there. Do I think AI is going to replace doctors? Not for a while. But I do think that doctors that know how to use AI well will replace those who don't.
No, I think it's a great point. I think that one of the things that I spend a lot of time in is kind of that interoperability space where we're sharing data. And I think the things that people don't always realize is that if we get to a point where we are sharing data at scale across the ecosystem, we don't have all the controls in place to understand where everything actually came from.
Yes.
And we run the risk of creating this tsunami of data that's getting bounced back and forth, this kind of conceptual echo. And, physicians like you, they're already overwhelmed. Imagine that you've got 15 facilities sharing data with each other and then sharing the data from the other 15 facilities with each other. How do you filter through all that? How do you get it all to the point where it's normalizable and usable? I mean, we've been doing this work with the Picky framework to create kind of a scorecard, and that's part of it. And I'm really excited about the momentum I'm seeing about having an objective way of assessing quality, but we still haven't fixed things like provenance in a way where we know that I've already got this data about Sarah Matt from this other place. I don't need it again. And I think that once we get fully interoperable and all the pipes are delivering information, I kind of worry about how we're going to wrangle all that data and not let it become, landfill.
Well, unfortunately, I think we're going to continue to have an interoperability problem for a long time. And so the Picky framework, I am very excited about as well, because I think that quality has often been a sticker or a stamp that people put on things but don't actually have a real definition of or have had in a quantitative fashion. So I really appreciate what you folks are doing there with that. But when I think about interop, we're going to continue to have interrupt problems because we can't just burn down the existing system. And Charlie, if I decide to do that, I will call you. You'll be part of the team. But, we can't start from scratch, unfortunately. We are working with existing hospital systems. We're working with medical records that are decades and decades and decades. So when we think about this, people like you and I, we've been around for a while. We've seen the tech, we've built the tech, and we've made some of the mistakes in the tech. Let's just be honest about it. And it's for lots of good reasons too. But we can't just start from scratch, and patients need to be cared for today. So yes, it'd be great if in 5 years I could have a beautiful, clean X, Y, or Z. But until then, I still need to take patients today in the office, take great care of them, and get as much information as I can to make those great decisions. And you can't get away from the reality of the current system. And I think some people will bring up their amazing, shiny AI. It's amazing. We should use this. And I'm not negating the fact that it's probably an amazing tool. But if it negates the fact that it needs to be used in real life now, that's where I have a problem.
What I find about technology, it's an amazing new technology until it hurts somebody. And then it becomes this technological pariah, and we say, oh, that technology doesn't work. When in reality, a lot of the times it's just we didn't really use it right. We were riding high on the hype curve, and we implemented something, and we maybe forgot that there are real people there that are impacted by this. One of the things I talk to my friends in Silicon Valley, and they talk about disruption, and we're going to disrupt healthcare. And I've been doing this a long time, and I don't want to be the guy with the sandwich board on the corner, but I say, healthcare is a disruption-proof industry. There are things we can do, but it's so vital. There's so much momentum when you implement something in a hospital system. It's not like you can just turn it off.
No.
You turn it off and things go berserk. So you have to respect the inertia of healthcare. And if you're going to try to transform or change healthcare, you have to do it in incremental, meaningful steps. You can't just come in and pull the tablecloth out from under it and expect that, oh, I'm going to fix healthcare. It's challenging.
You know, you use the word incremental, and people that are listening to this podcast are going to just start clicking stop wherever they're listening when they hear that. But what I'd say is that I'd like to redefine that.
All right.
Yes, you can't go big bang because we can't burn it down. True. But I think when people decide we're going to implement this solution, they don't realize they're signing up for an entire transformation of their culture, their training, their workflows, etc. If you're not prepared for that, then are you really implementing it properly? I would say no. So oftentimes we don't even see incremental improvement because they haven't looked at the entire ecosystem and the programmatic issues that will be caused by not properly training, change management, you name it, to make something actually successful.
No, and I think that's true. I think people underestimate the impact of process and human change when they do something like that. I also think that some of the approaches that worked in other industries just don't work in healthcare. I think that they're like when I look at all these folks doing these AI startups, I think you really have to have a lot of respect for what's happening in healthcare and the significance of it. It's not like advertising, it's not like retail. It's a very entrenched industry, and the trick is how do we make progress without having to burn it all down? How do we make that incremental progress? And and the people, my concern is some people come in, they do these grandiose things, and then people start to move in that direction. I won't name names, Microsoft, Google, but they make these big moves and people start to invest, and then they realize, oh my God, this is hard. I'm not going to do this. And they ride off into the sunset, and 10 years later they go, oh, maybe we should try healthcare again. And for me, it's like, for those of us that have been in it for 40 years, 30 years, 25 years, or
No comment.
a young person like yourself, the question is, how can we make meaningful change in healthcare and get to the point where it is actually the data we produce as a byproduct of providing care is actually useful and not a distraction. In fact, the whole Informonster concept, I don't know if you know the origin story of the Informonster. When my son was 5 years old, he's older than that now, but when he was five, he said, well, Dad, what do you do? And I said, well, in healthcare, they feel like they're supposed to go out and get all the information for all the patients and bring it together in one place. And they do that. But when they do that, what they don't realize is they've created this Informonster, this information monster, and it becomes a big distraction instead of being what they want it to be. Instead of being this useful asset that's going to power all these things, they realize that it's just this, it's almost like a hallucination of an oasis where if I can just get there, everything will be great. But they underestimate what it's going to take to get from pulling all the data together to actually turning the data into something that can drive your business. And it's still to this day. I mean, I've been doing this a long time, and I don't think it's me, but it's been a challenge to get control of it. And I think AI can help a little bit. I think improving data quality and making people realize that the quality matters, I think can help because there's a lot of quality deniers out there. So, anyways, I'm very optimistic that we're getting to the point with AI as the next Oasis driver. I think that people are starting to realize, well, maybe I do need to do something about data quality. But let me change the topics. Are you ready?
Sure.
So, when you were going through this journey of writing this book, was there anything when you were writing the book that really surprised you when you were doing the research and the work behind the book? Was there anything that you thought, wow, I didn't really think about this when I was starting to write the book?
So for me, first of all, the most interesting part of writing the book were the interviews. And I met with patients, executives in tech, executives in healthcare delivery, providers. And what I think I learned that was surprising to me is I hadn't heard all the stories. So you have your own expertise as a physician, as a technologist, from a real product management perspective. We talk to clients, we talk to patients, providers, you name it, whoever's going to be using or buying this, solution. But hearing folks that were many steps removed from that and their experiences, there's a great doc here at SUNY Upstate who is the first line of defense, if you will, for new refugees coming into the United States. And I hadn't really recognized the refugee population and what that means in healthcare. From a data perspective, you're starting from zero, to how they even get a prescription when they don't speak English, they don't understand the language, they don't understand the system, they've never even had healthcare before. So I think some of those were interesting insights that I hadn't considered before, because I know what it's like to be in a lot of different places in healthcare, and I've talked to lots of people over my many decades. But at the same time, there's always these new groups, these new problems, and these new situations that I find are absolutely fascinating, because if we could solve for the difficulties these people are having, it would help everybody.
Well, and I think that when you think about the concept of access, I mean, there's political, there's geographical, there's technological, there's data, there's financial. I mean, there's a lot of different factors that could impact that. I'll share something. I mean, I have an adult son who is autistic, and he's 30, and he was on Medicaid for a long time. And I always felt guilty about him being on Medicaid because, I make a decent living and we can afford health care. He can't be on my insurance anymore because he's aged out. But the reason he was on Medicaid is because there are all kinds of services for someone who is special needs that you can't buy. If you're not in the program, you don't get access. And so my wife was constantly, battling to keep him on Medicaid so that he could have access to these services. And I mean, as of right now, earlier this year, he got bounced out again. So he's constantly getting bounced in and bounced out. And so now we're kind of going to the marketplace to try to find some kind of a program for him. But and honestly, a lot of the people that provide those types of services that you can't just buy are willing to do it for nothing if you can't get access. And so, talking about access, there are these variables where I'm sitting here thinking, I can afford to pay for his premiums for a healthcare plan, but even if I do that, he can't get access to these things. And so it's a multi-variable issue that I think a lot of people are impacted by.
I mean, the system is complex.
Yeah.
And unfortunately, that means it's hard from all sides. It's hard from a patient perspective to get the care you need. It's hard from a provider perspective to help your patients get what they need. It's hard from a caregiver perspective to advocate even in the best of situations. And, ultimately, it means everyone's suffering. So this is another reason why we're getting burnout for nurses, doctors, et cetera, because they can't take care of their patients the way they'd like to. And the patients are exhausted. It's just exhausting.
No, I agree. So is there any low-hanging fruit in all the research you did? Are there things that you think, hey, we should be able to accomplish these things? Not to give away any secrets in the book. Keep some secrets from the book for the readers. But is there anything that kind of jumped out at you and said, this is really something that we should be able to fix?
So for me, again, the 5 pillars, I break it down into geography, financial, digital, trust and knowledge, and cultural. I think the easiest one, the low-hanging fruit, if you will, is probably digital. Right now, when we think about getting quality internet services to rural environments, that seems like we can make a plan and have that happen. When it comes to, hey, what would be the minimum requirements for a cell phone or this or that so that a televisit could actually be produced on it? Okay, I bet we could do that. I think that there's pieces in the digital space where we could educate people at whatever level they're at, in whatever language they need, in whatever case they're at, wherever they are, to be able to access some of the services that are now tried and true. Telehealth has been, pumping like gangbusters since COVID and since way before that as well. And when we think about the ability to make appointments, get prescriptions, et cetera, from your mobile device, that's a big deal.
Yeah.
And so to me, that digital pillar, I think that's the easiest piece we have as a barrier to take care of in a short term.
Okay. Well, before we wrap up here today, first of all, thank you so much for your time. For the people that are listening, how can they get your book?
Oh, well, the Borderless Healthcare Revolution is available anywhere books are sold, and you can check it out at drsarahmatt.com, and it has all the information there.
Excellent. I'm going to read the book. You just gave it to me yesterday. I'm not that fast. And I was going to wait for the audiobook. Is there going to be an audiobook?
I'm working on it. I'm working on it.
I travel a lot. But so I'll give it a read. And would you be willing to come back so we can talk
of
more about the
course.
book itself?
I can't wait to hear what you think about it, Charlie.
All right. Well, hey, thank you so much for being on today. And thank you all for listening. I am Charlie Harp. This has been the Informonster Podcast.